My name is Donna Kelly Williams. I have been a registered nurse at the bedside for almost 40 years and currently work as an obstetrical and neonatal nurse at the Cambridge Health Alliance. I am also the president of the Massachusetts Nurses Association, representing over 23,000 registered nurses and healthcare professionals. I am here today to testify in support of House Bill 1958 and Senate Bill 1206, an act relative to patient safety. As you can see here, I have been joined by nurses from every corner of the state, from community hospitals and academic medical centers, and each one of these nurses represents thousands more who could not be here today because they are at the bedside caring for patients. These nurses have come here today because they are concerned about their patients. They are here to support setting a safe limit on the number of patients a nurse can care for at one time. Right now, save for the intensive care units, there is no limit to the number of patients a nurse can care for at one time. This is dangerous, and we are putting patients at great risk. Last year, we took a good first step. With the unanimous support of the legislature, we passed a law setting a limit on the number of patients a nurse can care for at one time in our state's intensive care units. This will help to protect the sickest of the sick. But we are back this year because conditions continue to deteriorate in other units. So it's time to take the next step and expand safe patient limits to all units in all hospitals. Each one of these nurses has a story to tell you about how patients are not getting the care they need because nurses are being forced to care for too many patients at one time. Each one of these nurses represents hundreds of stories their fellow nurses could tell. If we had each nurse come before you to tell his or her individual story about the consequences of caring for too many patients at one time, we could be here for weeks. But we are hoping you hear our voices collectively today. I would like to take the time now to ask these nurses some questions so that you can hear from them directly about how the lack of safe patient limits in Massachusetts is affecting patient care. How many of you believe that patient care is suffering due to you and your fellow nurses being forced to care for too many patients at one time? Thank you. How many of you know of a medical error, such as a patient being given the wrong medication, resulting from a nurse being forced to care for too many patients at one time? Thank you. How many of you feel that this problem of being assigned too many patients at one time has gotten worse over the past 5 years? Thank you. Due to your concerns about safety and quality care, how many of you would not admit a loved one to your own hospital? Thank you. Members of the Public Health Committee, we need you to hear us. We have just told you what we are experiencing. Our patients are suffering. Every day that goes by without a law in place means that preventable medical errors, more avoidable complications, increased length of stays, and readmissions are occurring. In some cases, it is the difference between life and death. And I thank you.
Thank you very much.